what we were discussing as what we call the MFM is the multifunctional movement. So it's basically a series of movements that has several components in it that we use as an exercise for the patients. All right, now why do we use that? Because when we function every day, not everybody's doing like straight planes, right? Not everybody's just doing this, not like doing leg extensions, straight leg raises, not that. We move in multiple directions. We always have combination of patterns. That's what PNF is about. That's why we have those diagonals, all those things. Now that's why we incorporated that into our treatment. One of my coaches did that before, introduced me to it, and I think it's very functional, and not only that, it's fun for patients. Now, I want to discuss at least the basics of that, so you guys will understand why it works, and also why do we give that. Okay. Now, there's different levels in terms of the physical therapy. Everybody knows we start with pain relief, right? First thing is we have pain, but that's not the end point. I think you guys have heard me say that's not the end of when we do physical therapy, because pain is easy to achieve. Pain relief is easy to achieve when you can use CBD, you can use laser, you can do electrical stim or something. Even just sometimes using contrast bath, cold pack, you get pain relief for it. Does that mean that you're well? No, right? So this pain relief, then we have to adjust range of motion. Because if they're stiff, you want that flexibility. Then we have strength. You have the stability, right? So you have the strength, and then what we always tell patients, we want to target the function. Why? Because that's the most important for the patient. They always want to be able to do something. You ask the patient, what do you want? What's your goal for therapy? Oh, I want to have 4 or 5 muscle strength on my quads. You never hear that, or I want to just, get my quads stronger. You're not gonna hear that. Usually they're gonna say, I want to be able to fish, I want to be able to hike, I want to be able to run, I want to be able to jump, right? I want to be able to lift. It's always function. So at least that's the basic, or like the basic level where we want to be. But there's higher levels than that. From function, then you have coordination. We do coordination therapy with some of our patients already. They have Parkinson's, like you have balance issues, elderly people, right? So coordination is a problem. They can be strong, but they may not have coordination. And then they can have the other levels, agility, and then you have athleticism, and that's when you have those athletes. Why they get paid so much money? Because they can perform at a level that nobody else can, or very few people can. All right. So those are kind of like the different levels of for physical therapy. That's why I don't want to get stuck with just pain relief. At least for us, we want to be at least at the functional level, because that means something for the patients. Okay. Now, for the basics of when you do those kind of movements, you have 3 different types of muscle fibers. PTs, you kind of know that. You have the deep red muscles, right? Those are the slow twitch fibers. Okay, they're high in myoglobin content. They're more like low power but endurance based, higher endurance, because they have more myoglobin there, more blood there. Then you have the orange fibers, type 2A, which is a fast twitch fibers. Okay, they have moderate power, but then they also have some endurance and speed. Okay, they have medium amounts of mitochondria, medium myoglobin content. Now then you have the white muscle fibers, type 2B, which are your fast twitch type B fibers. They have low myoglobin content, right? But they have great power. So those are the ones you use for powers, like power activities. Okay, but they have low amounts of mitochondria. So if you have a low power, high endurance, you have high power, you get low endurance. It's vice versa. Okay, now these movements that we're gonna be learning about, they will incorporate different types of muscle fibers. They will activate different types of muscle fibers. Different activities, such as when you do plyometrics.
Who has that higher?
I mean,
Fast twitch, slow twitch,
Fast twitch.
intermediate.
Yeah.
Intermediate.
That's how I remember it.
It's about it.
Yes,
It's about
that
it.
is true.
I mean, I
Okay.
could,
Type 1, type
not like now that
2.
you reminded me about it, I can
2A,
explain.
2B.
it.
Yeah,
I totally.
those are confusing. I had to do like
Oh,
a
yeah.
chart for both.
Just-
Genetic,
Yeah.
genetic,
Yeah.
genetic
We're-
base.
we're
Type
good?
1, type 2, type B.
All right, so we'll continue that. Okay. So, when we were discussing earlier, so you have pain, range of motion, strength, those are self-explanatory, right? We know what those are. The function is when you start having some movements there. So there's a purpose to the movement. When you have a range of motion and the strength, there's a purpose, then you have a function. So what is coordination? So coordination is when the body is able to adjust timely and also there's good balance. So you can have function, but then you may not have coordination. Why? It's because your function doesn't have good form and doesn't have good balance. So coordination incorporates those aspects. Okay. Then the agility is you have coordination, but then you add another component. What do you think is a component that gets added to have agility? So you have coordination now.
Speed.
You're gonna add speed. So agility is you have coordination with speed. All right. And then when you get to the athleticism, what component gets added to agility to get athleticism? Strength,
Power.
yeah. Power, not quite. Endurance.
Oh.
That's when you have the agility with the endurance, then you have athleticism. That's why they're highest level, because very few people can actually achieve that level. And that's why they get paid big bucks. All right. Now, when you look at the body, they divided the body into what they call 4 subsystems. What are the 4 subsystems? This is going to be the basic of when you do punches, when you throw kicks. Why do we pick one over the other? Okay. The 4 subsystems, one is the lateral subsystem, right? And then you have the longitudinal, which is going to, let's say, in the back, in the middle. Then you have your oblique, anterior oblique, and posterior oblique subsystems. All right. So just quick run through. The lateral subsystem is made up of, you have your gluteus medius, which is side, your TFLs, right? And the adductor complex is not only out, but you have to have the inside, the adductor complex, and the opposite QL, quadratus lumborum, right? Because that's gonna, it's involved in keeping you level, okay? Examples of exercises or movements that will work that lateral subsystem is if you do side kicks, you do roundhouse kicks, which we'll practice that later, or when you do jab punches or rotation punches, that will incorporate those. Now the deep longitudinal subsystem, it's made up of, so that's like kind of like the back in the middle, that's made up of the erector spinae, right adjacent to the spine. Then you have your thoracolumbar fascia, which is like more to the side, okay? Then you have your sacrotuberous ligament, like down here, all right? And then you have bicep femoris, kind of like the hamstrings area, okay? So that's lined up in the middle part, from the mid all the way down to your thighs. So you're working the deep longitudinal ligaments, the muscles there. Example movement that works those will be your leaps and your jumps, because then they contract and then they have to spring. Okay, the anterior oblique subsystem is made up of your internal obliques, right, and then your external obliques. Okay, then your adductor complex in the inner thigh, and then the hip external rotators. The hip external rotator, what muscles do hip external rotation?
The red carpet.
What? Glutes?
The red carpet muscle, so your,
Mhm.
I forgot the acronyms for it, but then your piriformis,
The piriformis at a certain
your-
angle,
the
right?
other QL,
Like now,
Mhm.
yeah.
Yep.
inferior and superior, what's it called? The teeny tiny muscle.
Alternus.
Obturator.
Operator.
Internus,
Internus.
externus.
Yes, so those smaller muscles that are here, right? So those are the ones that control your hip internal external rotation. So All right, so that's the anterior oblique. Now, what exercises or what movements uses those muscles? Your medial chops, like which you'll see later. So when you're doing chopping movement like this. Now for the PTs, internal, external oblique, which one is the muscle aligned this way and which one's the muscle aligned this way?
Internal, external,
So external oblique is the one that you put your
External. internal.
right? The one that you put your
Opposite.
hand in your pocket, right? That's the external oblique, and then opposite that is your internal.
Wow.
Okay.
What?
When you're holding boobs.
Yeah, they do it that way. Okay, I never
just
heard
know
that before. First time I heard that. I just know the
just know the
pocket.
Wait,
opposites.
what?
External
So
is when you're putting your
external
hands in your
hands
pocket.
in your pocket, so the fibers are going this way.
Yes. Mhm.
Internal, the fibers are going this way.
Yes.
Like you're
It's like
holding
the
boobs.
opposite, like
Yeah.
you think the internal's going in.
That's
but
how I
usually
remember it. I
the-
didn't think about the
Yeah.
boobs though.
Okay. I didn't hear that,
You
but
need to
now I know.
memorize things,
All
and
right.
You're gonna need to make them fun.
Yes. So now, so the anterior oblique, so medial chops, cross punches. You use your obliques on cross punches, right? We do that a lot with the patients. Body punches, right? When you're going down low, and then roundhouse kicks, because you're doing that angle. So you're lifting it at the diagonal. Posterior oblique and is made up of your glutes max, the latissimus dorsi, and then your thoracolumbar fascia again, the bit back here, and then the hamstrings also. So that's your posterior oblique. So what muscles, what activities uses those muscles is gonna be the donkey kicks, which is a back kick, okay, lateral chops, and then you're doing backhands or back fists, because then you're using your lats and then you're using the thoracolumbar fascia. All right, so those are just basic examples of when you use those different subsystems. So the front, right, you have the sides, and then you have your deep longitudinal back. In the front, you have anterior and then posterior. So this way and then this way. Okay. All right. So now those are at least now you have some idea of the different muscle systems, different systems that we want to work on when you have the patient. Now, we'll go into the punches and the kicks later, and then we'll do the yoga. The yoga is different. The yoga is because the yoga actually primes the nervous system. When you do those punches and kicks, they work more on the muscular part. The yoga forms, and that's why they're so effective, is because they actually prime the nervous system. People think it's just, oh, stretching. Yoga is just, it's beyond stretching. Okay, there's different, a lot of different effects that's beyond the stretching alone, and aside from relaxation, because it actually primes the nervous system, just the way the forms are created. And we'll practice some of the most common forms that we like to use with the patients, and you'll actually see them there. All right. Now, before we get to that, just to give you an idea, especially with the therapist and for the aides, some of the things that progressions we can give patients, different positions that we commonly use with patients. If they're in quadruped, let's say, these are called functional positions, because these are positions that kind of like when you have a baby growing up, they go through the different positions, right? Crawling, they go quadruped, they go half kneeling, and they go sitting, standing. Those are functional positions. So people, as we develop and as we get older, you can actually base exercises on those positions. So let's say, for example, in a quadruped, how can you make the regular quadruped like that? How can you progress that? How you can make it harder? You can actually have any suggestions, any ideas? How can you make that a little harder? How can you progress the simple alternating arm and leg in quadruped?
Add weight.
Therabands, yes, and without any weight, let's say, for
lifting the
example.
knees.
Stability.
Lifting the knees, yes,
Changing the
Mhm.
motion that they're doing.
and change the motion, change the base of support.
Basic support, yeah.
One thing that you can remember there is when you change the base of support, or when you add jumping, that you can progress any exercise, and that's what they call the leans and the leaps. Because when you start changing the base of support, make it smaller, it gets harder, right? Or when you move their body, their center of gravity away from your base, it gets harder, because then you're more unstable, right? So any exercise you can actually do that. And like simple push-ups, what you can do, have them go side to side. That makes it a lot harder, right? So for the quadruped, lifting the knees off the ground, that makes it a lot harder. You guys can try that. And keep your back straight. They have to have really good core control, okay? Or you can have them in quadruped and then start doing some crawling movements. Move them forward and back. That will include some dynamic stability there. Then that makes it harder also, okay? Quadruped, they said the quadruped exercises can actually make people run faster. It's because of the muscles that are involved when you're doing that exercise, okay? So let's say for crawling, what things can you do? We don't really get patients to crawl, but that's one thing that you can have either for peds, or some people who want some dynamic stuff, they can actually do that safely. Crawling, you can have them do kind of like a spider crawl, going lower on the ground, and you're changing the center of gravity there from higher to lower, right? Or you can use, and that's why we have those boards. Aside from just walking in the boards, you can actually make them crawl on those planks. The narrower the base, the harder it is, okay? But we don't use that a lot, so I don't want to spend too much time on it. The other one is a push-up. Different variation, your guys are familiar with different variations of push-ups? Name a few, so that not everybody's just doing regular push-ups.
Kneeling push-up.
Wide arm push-up.
You get wide and kneeling, close and narrow, like a
Wall
triangle.
push-up.
Diamond.
The wall push-up is the easy, right? The diamond push-up, you get closer.
Knuckle push-up.
Knuckle
Then you get
push-ups.
knuckle push-ups, right?
One hand.
Yeah, one hand
hand
push-up.
push-up.
One hand push-ups.
No hand push-up.
And
A
then
hand, a push-up with a clap.
that you involve plyometrics. That's pretty hard. Some Bruce Lee fans, they go fingers. Can't do that. But
Pokey push.
yeah. Or aside from, now that you mentioned plyometrics there, you have the jump. What else you can do? You start doing burpees on that one, right? You push up and then you jump up. So you do that, and then you can actually, I mentioned earlier, move side to side. You can move forward and backwards when you do those push-ups.
Push-up
Right.
with rotation.
Okay, you can do those. Let's say half kneeling. That's something that's easy for us to get patients to do. Stay in one place. Half kneeling exercises. What are some of the things that you can progress with half kneeling, or you can actually introduce half kneeling? Because they're half kneeling, can have them reach back. Right. Let's say, you guys know what half kneeling position is?
Yeah.
Kind of like
No.
on a lunge, right? Right? So they're doing like that. Okay, what do you do in this position then?
Get up.
You can get up, or you can have them, well, some basics are they toss a weighted
Throwing,
ball
Rotation.
in rotation, bring it another step up. And further is rotation, you can actually have them rotate and try to touch here and tell them, okay, now you try go even further back, right? And then do it on the other side also. That will work on the posterior systems there.
A medicine ball.
Yeah, medicine ball. So those are things that you can, these are easy things to do with the patient because they stay in one place. Right? You can use the strength for the back, the lats. Those are the ones that when you start reaching forward. You guys, I want you guys to try this like on yourself also. Then you'll see, oh, you know what, it actually works that muscle. You can have a patient do the exercise afterwards. Okay. So that's the half kneeling. You can actually have half kneeling with some, we said we have leaning and then also some jumping. We can progress that using some jumping. How do you do half kneeling and jumping? You can have them do like this, right?
Knee to
Either just
knee.
bounce and then have them do that, right?
No,
Well, I was
never.
thinking about alternating.
So yeah, switch
That's
leg.
even harder. Then you can have them do that,
No.
right?
I'm gonna bust my knees.
So those are the, if you get
I think
higher
I'm gonna
level, right? So, but you don't need weights with those. I actually work out with, I use these activities because then you don't need, a lot of fancy stuff. Okay? So those are simple ways that you can actually challenge the patient. Okay? and it makes it easier for us because if you look at, okay, what's the goal that they have, what's the functional goal, and then you can just base it and just keep progressing on that one exercise. You don't have to keep in, like, you know, creating new exercises. Then you have a patient that has like 10 to 15 different exercises. Get everybody running crazy, and the patients, they complain, they tell you, oh, I have to spend 30 minutes just to finish your exercise. Oh, you know, I have to spend 1 hour, and nobody wants to do it. Okay, just make it hard enough for them, make them do it like what, 3 sets of 20. That will be challenging enough for them. Okay, all right, then the standing, a very common position. How can you make standing more challenging for the patient?
Jumping.
The jumping, they incorporate jumping, so simple hopping in place, right? Then you have jumping jacks, we do that a lot. Then what if you want to go higher level than the jumping jacks? You can have spread eagle jumps, right?
One leg jump.
Spread eagle jumps is if you
Oh, okay.
do that. Okay, then you can have scissor jumps, go forward, back.
One leg jumps.
You can one leg, you can have box jumps, right? So those, I think, is more common, so people can imagine those exercises. Aside from that, so you introduce leans on it, so narrow the base of support. You can do, that's when you do one leg activities, such as kicking is one of those. You do different kicks because then you're doing one leg balancing on those, right? Or then you start doing some running. So those you can add that, okay? Now, the stooping, okay, stooping, we don't do a lot of that one because, well, you can add that to the patient's program also. The stooping is, they're stooping forward. We don't do a lot of that because if they are not doing the form correctly, they can hurt themselves. We can introduce that, but make sure the patient is doing the form correctly. All right, especially if they have the back pains already, you don't want to just have them do that and then leave them on their own, right? Same thing you can have when they're stooping, you can have either some weights there, or you can have them do some different movements already, okay? Or have them do some, let's say, punching, right? Just to give you an idea, in a different movement, reaching backwards in a stooping position, okay?
Stooping is just.
Yes. Yep. Stooping is that. Kind of like bent forward, kind of like when you're doing a bent over roll, so stooping, so you gotta get them to turn this
So
way.
those are patient posture.
So, right? But then they end up usually like this. And then the back, you're gonna hurt them. They're gonna hurt themselves when they do that, okay?
Isn't it like sit to stands when they bend over?
They sit to stand, they can do that, right? So when they're stooping, maybe have them do it in a chair. It's safer that way, all right? Or start using some TheraBands with it, okay? And then the squatting, okay, squatting, we do patients, a lot of patients do our squats. They always keep doing the same squat. How can you spice up the squat a little bit?
Squat jumps.
Squat jumps, if they're higher level, we do squat jumps, or just sometimes, you know, like hops like that,
Squat on the.
right? Or
Lateral
On that
squat.
box over there.
you can
Eccentric squats,
eccentric,
lateral squats.
yes. Then you can do one leg, right? So you can do one leg squats. Those are, can have some, you know, leaning after the squat. After, let's say you go 3-5 jump, or 3-5, and then you can do side, you know, like side squats, lunges, you know, those. You can actually do that. Then similar position next is when you do lunges. Aside from just doing regular lunges,
3D
what can we do with lunges?
3D
3D
lunges.
lunges.
3D lunges, we're changing the direction, yes. What else?
Walking
Lunge
lunge.
jump.
You can
Walking
do
lunges.
walking lunges. You can.
Lunge jump.
Then you add some hops there. You can do like that. Okay, what else?
Oh, I meant to rotate it.
Mhm.
Like leg to leg.
Like leg to
Squat,
leg,
then
yes.
jump, and
They can do
Eccentric
that.
struts,
Before you do
okay.
alternating, have them do it one position first, and then you do
lunges.
alternating, yes. And you can have them do actually lunge instead of just doing this. Have them just lift this heel off the ground, and then have them do a lunge like that.
And then the lunge on the.
Balls.
So they're
What
on
is that
Oh, on the
called?
ball.
on the
Bow
bow, so
Bow
yes.
suit.
So they have on their
Everyone's
toes
getting
on
that
both
too
feet.
next week.
Right? So those are things that you can actually, instead of just doing lunge, have them just lift your heel off the ground, the front one. They're gonna be more unstable that way, and that includes a balance. And it's not straining anything else, and it will challenge their balance. You're gonna see that they're really bad at it. Okay, and then they will say, you know what, I'm bad at this, so that's why I'm coming here. Or if they don't realize that, and say, wait, that's why you're here, right? Then they see the need. Oh, you know what? Well, that's why I come here, because you guys tell me this, because nobody else does. Okay, so those are things that, or even lunges, they can touch. They can touch the foot instead of just doing a regular lunge like this. When they go down, they can.
And they also
add
do
some
like a
rotation.
medicine
That's
ball
a
throw.
yoga pose.
Mhm.
Get a lunge,
You can do
That's a
that.
yoga
you can
Mhm.
toss, like lunging like this, and then
Then
toss
you-
this yoga ball.
Then you can, you know, put that. We have
That's a
some weighted
popular
balls
one.
there.
Yeah.
Right.
And
Okay.
also
yeah.
going back to
But it's not lunges.
Mhm.
Oh.
They're doing that.
What pose is
Yeah.
that again?
I forgot.
It's kind of like a warrior. I think
You
it's
could
seven
like
That's a warrior
go
three,
back.
something
No,
like
that's
that.
what
Warrior
warrior
three.
please.
Is it that?
Warrior three is
I don't know.
All right. Like, I know there's something like that. Yeah.
Two. I like that too.
Yeah. I like. For me, I like the two.
Yeah, two is a good one.
Yeah.
Hip flexor.
So then you have the jumping, you have box jumps, you know, all those things. And you know, drop jumps, and then you have, you know, lead, single leg, double leg, you know, all those things. So I hope you guys got an idea on how to be creative. And this is not everything. Be creative, you know, do it, see how you feel, make sure the patients know how to do it. Start with the basic, whatever position you want them to improve on, whatever muscles you're working, whatever function, whatever movement you want the patient to do. Then just add these little, you know, differences there, little progressions. So you don't have to come up with an exercise like, oh, you know what, oh, how do we come up? Then I frequently see like when I did, what was it, when I was covering for an aide before, when I open up the exercise sheet, I'm like, damn, like it's a lot of things to remember. Like I myself can't even remember half of them,
Bringing those.
right? So let's make life easier for us.
I said Jason in there.
Right?
I know.
And imagine if that's a patient. And I tell you, some of you have seen me work out like after work. My workout is a 15-20 minute workout. And I do only 4 exercises, split into 2. I do a HIIT training. 2, 1 minute rest, and 2. I do that 20 reps, 3 sets. And it's enough to challenge me already. And I'm healthy. Our patients are not. It's gonna be more, and that's only like 4 exercises, 3 sets of 20. It's gonna be enough to actually get them challenged. It's actually enough to get them strong as long as they do it. If they do it often enough, they'll get stronger. Okay, so you don't have to, you know, do anything fancy. Like that's my point there. Make it easier on us, make it easier on patients. Because if you give me the reason why I do 15-20, that's the reason why I do HIIT training is because my excuse is I don't have time. I have a lot of things to do. I want to go home to my son. I want to do this. I want to go that. Right? If it's not under 20 minutes, you won't see me do it. I just can't continue doing it. If it's 15 to 20 minutes, I can convince myself to do it 5 days a week. So because if not, then I have a different problem. When patients can't do 15-20 minutes of exercise, then they have a different problem, right? But if you tell them you have a 1 hour exercise, honestly, who's gonna do that? I won't, right? So that's for me. Okay.